A deadly and all too familiar shadow has fallen over Central Africa. In fact, the Democratic Republic of Congo has declared a new outbreak of Ebola, with at least 15 people already dead. In a country pushed to its limits by conflict, health teams are now in a desperate race to contain one of the world's most feared diseases. Ebola is a fever born from a virus. It is transmitted to humans from animals. Fever, muscle pain, vomiting, diarrhea. A cruel progression leads to internal bleeding, organ failure. It spreads through blood and bodily fluids, not by air. Patients remain infectious once symptoms appear. In fact, making rapid isolation vital. For the DRC, in fact, this is alarmingly familiar terrain. Ebola has struck repeatedly, 15 outbreaks since the year 1976. Violence, poverty, mistrust, making containment brutal and difficult. Health workers facing danger, local communities resisting, supplies running short. This fragile system fraying under each crisis. Global responders, meanwhile, have mobilized. The World Health Organization is deploying experts, testing labs, PPE, treatments, and the vaccine to stem the tide. Community outreach and surveillance are ramping up. As Congo fights on, the virus knows few limits, threatening lives and draining hope and raising fears of yet another catastrophic spread, possibly. And for more on this, our correspondent getting us this report.
Through a 34-year-old pregnant woman detected a few weeks ago, DRC is once again faced with the Ebola surge, as about 28 suspected cases with over a dozen deaths recorded so far, including health workers. Thankfully, lab tests have confirmed the Zaire strain of the Ebola virus, a highly deadly but vaccine-preventable variant. But the challenge now is deploying logistics to get vaccines to every corner. Now, authorities say the WHO teams are already supporting the response, deploying expert and medical supplies needed to protect health workers and care for patients. This is the first Ebola outbreak in the DRC since 2022, when a smaller outbreak in Equator province was contained in under 3 months. Health officials are leaning on the country's extensive experience with Ebola, but with transmission ongoing, case numbers are expected to rise. From Lagos, Nigeria, Louisa Olani, WION, World is One.
To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.